Second chance. My name's Marinda Hill, recording scenario for assignment 3 for APS402, which is a respiratory systems assessment. So Ed is my patient for today. As I'm entering the scene, particularly if it's in a residence, I'll be looking for before I even see the patient, looking for and smelling for things like smoking, looking around for oxygen tanks, tubing, any medications, particularly puffers, antibiotics, any cardiac medication or just any medication in general, and also having a look at the state of the premises, which might indicate, it might reflect how the patient looks after themselves and their health. So as I walk in, I'm looking for those things, and then I see my patient. Hi, what was your name?
My name's Ed.
Hello Ed, I'm Marinda. Do you mind while we're chatting? I'm just going to have a feel of your pulse. Is that okay? As I feel for the patient's pulse, I'm also feeling and looking at their skin, overall skin colour, looking at their positioning, whether they're in any type of discomfort, any respiratory distress. I'm feeling the temperature of their skin, whether they are diaphoretic, whether they are cyanosed, pale, or they're well perfused. And I can also feel that Ed has a nice, strong, regular, normal pulse at the moment. So thank you, Ed. Feeling good? What is happening today, Ed? I believe you've called for some shortness of breath?
Yeah, I've just been feeling short of breath for a couple of days. And yeah, it just feels really hard to breathe.
Okay, a couple of days.
Yeah, it got worse today.
Okay, so worse, so do you reckon maybe 3 or 4 days?
Yeah.
Okay. And with that, have you experienced any other symptoms other than the shortness of breath with it?
I've had a bit of a cough.
Okay, cough.
Yeah, coughing a bit more. And
yep, is there anything coming up when you're coughing?
Yeah, just like a bit of a yucky sort of yellow.
A yellow, like a yellow phlegm coming up with it. Okay, cool. So you've had a cough for a couple of days. You've been coughing up some phlegm, some yellow phlegm with that. What we might do, just because you're a bit short of breath, I might just sit you up a little bit more, just to help while we're chatting. With your shortness of breath, do you find that it's worse at any point during the day?
Not really.
Or position, like if you're laying, sitting, if you're mowing the lawns, is it worse if you've been doing any physical activity?
Yeah, I think when I get up and try and move around a bit, it gets a bit worse.
Okay, so a little bit of shortness of breath on exertion. Okay, is there any pain along with your breathless or coughing?
When I cough, my ribs hurt a bit.
Your ribs specifically, so is it down?
It feels like down the sides.
And how would you describe that pain?
It's like pretty sharp.
Yeah, so it's sharp on both sides?
Yeah, both sides.
Any other tightness or pressure feelings in your chest?
Yeah, I suppose it feels a bit tight.
A little bit.
A bit of a coughing fit.
Okay. And when you're not coughing, is there any pain?
No.
Okay, that's good. Okay, have you had any other symptoms? So you said you've got a yucky yellow phlegmy cough. Have you had anything like fevers, feeling hot, cold, chills?
I get a bit sweaty at night,
Yeah,
I notice when I'm sleeping.
Yep.
I don't have a thermometer, but yeah,
I feel like you're a bit...
I felt a bit cold last night actually in bed, but I was sweating.
Okay. And any nausea, vomiting, headaches?
No.
Nothing like that?
No.
Any tummy pains?
No.
You've been eating and drinking okay?
Yeah.
And opening your bowels and weeing, all that's okay? No burning, stinging?
No,
okay, cool. So it's just this kind of cough for the minute. Okay. And so at the moment, how long do you think it's been worse for? Was there something that triggered it to become worse, or it's just like what's triggered you to call today instead of yesterday?
I think it's just been slowly getting worse, but today is just a bit more than I can manage.
Yeah, okay. And with that, so you've got, have you had any other recent illness at all in the last couple of weeks? Have you seen the GP at all for anything?
Don't like the doctor much.
Yeah, fair enough. Don't blame you. And have you had any trauma or anything to the chest or any other part of your body that could be also causing this pain? No, so it's just...
Yeah, I've just been messing around the house.
Yes, you have.
Yeah.
Yep. Okay. All right. So you've been well recently. Have you ever had like a chest infection or anything,
Yeah.
or a cough before?
Yeah, I've had a chest infection before.
And I can see ashtray here.
Oh,
Do you, how many, yeah, you do. How many do you think you'd smoke a day?
Oh, 25.
About 25 a day?
25 a day.
You must have a well-paying job there. Yeah.
Expensive these days.
And with your smoking, do you ever get wheezy or short of breath? Have you been looked into for any kind of asthma, emphysema, COPD?
Yeah, they did say something about COPD. Sounds familiar.
Yeah.
The doctor started me on the puffer there.
Yeah, I can see the purple one and the blue one. Use them.
Yeah.
Are you compliant with
Yeah,
using
I
them
use
when
it.
you should?
Yeah, the blue one normally helps.
Yeah. How often are you using the blue one, would you say?
About 4 or 5 times a day. I've probably bumped up to about 10 in the last few days.
Yeah, okay, that's a fair bit, isn't it? And are you getting any relief from your blue puffer today?
Nah, like not like I normally do.
Yeah, okay, all right. Okay, and do you have, other than the lung breathing problems, do you have any other medical problems? Do you take any medication for your heart or diabetes?
Just blood pressure. Yeah,
your blood pressure medication.
Yeah, I think the doctor who got high blood pressure started me on a tablet.
Yeah, do you know what it was called?
Perindopril. Yeah.
Perindopril, okay, cool. That's good to know because that type of medication could also kind of trigger a little bit of a cough, but with the other history of the smoking, it could go either way. And any other medical problems there, or have you ever had any surgeries, or had any time in hospital, or
just the blood pressure, just the cough has got
blood pressure, cough. Okay, cool. Any diabetes?
No.
Nothing. Okay. If you think of anything else, I'll have a look through all your medications soon, and I can see that's kind of all you've got next to you. So we'll have a better look at that later. And are you allergic to anything?
No allergies. No.
Good. Okay. All right. So Ed, if it's okay with you, just before I deep dive into any more of questions, I just want to do a few more observations just to make sure we can get through the next 5 or 10 minutes safely.
Sure.
So if it's okay with you, I'm just going to do a baseline set of observations and a few additional bits and pieces, and then we'll continue the examination. Is that okay with you?
Sure.
Cool. Okay, so my first point of call, it seems to be a respiratory illness. I'm just going to check a few respiratory based observations, and it sounds like he's had fevers on and off, so I'll check a temperature first and foremost as well. So I'll just pop this on so it can start to get a good read while I'm checking. I might just get you to swing your legs around to the side. Thank you, and have a seat. I'm just going to listen to your lung sound, so just nice and quiet first. Oops, dear me. Okay. All right. Just in and out as normal. Right, sounding a little bit of maybe consolidation down the bottom, really slight wheeze. So I'll have a listen to the front too. Thank you, nice and straight back, very good. You've done this before, haven't you?
That's not nice.
Stay there. I'm going to do a few more things with your chest after we do a few more observations. So saturations aren't looking too bad there. You probably just had a bit of Ventolin? How
Just
long
before
since
you walked in, I think.
Yeah. Your heart rate's fairly normal. Okay, so you can hear a little bit of unusualness in your chest, whether it sounds like a little bit of wheeze, a little bit of crackle, so you might have a bit of an infection brewing there. Your respiratory rate is up a little bit as well. I'll just check your blood pressure. Try not to have a trip hazard there. Taking your medication, Ed?
Yeah.
Your blood pressure's up a touch, but you do have a history of high blood pressure, so clearly not super uncommon for you, but something to note. What about the obs? Check your temperature. Oh yeah, very, very slight temperature, only very mild, but enough to... Okay, so we've got those obs, and now I'm just going to do a couple of other observations. I'm just going to shine a little torch in your eye. Okay, just look at my nose. Yep, pupils look good, eyes okay, you haven't had any problems looking at the light or blurred vision, dizziness, no issues there. I am, okay, cool, good. All right, happy with that. Oh dear me. Ordinarily I would get this patient to do a peak flow meter, but as we're during COVID, what I'm doing at the moment, I don't have that equipment available. So we're not going to do a peak flow today, but ordinarily I would get you to do one. I'm just going to get you to up here for a minute, back how we were. Are you comfortable in that position? I'm just going to lay you back a touch. Is that okay? Cool. So Ed, you're 68. You're not quite a spring chicken anymore. Although it does sound quite like something going on respiratory wise, just because of your you've got a couple of risk factors I've identified already. We're going to do cardiac examinations as well. So I'm going to do an ECG to check your heart as part of this. So that will just expose, I'll just have to expose your chest, put a few stickers across it, and we'll assess your ECG. Is that okay with you? Sure. So I'll do a 12-lead ECG, pop, 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 pop. And while I'm doing the 12-lead ECG, I'm just looking for any scarring, lesions, any visual abnormalities with the chest. Also looking for just any deformity, anything unusual, also sweatiness, colour, those types of things. ECG looks quite good.
Excellent.
Yeah, cool. Okay, now we're going to move on. I'm going to do basically full body examination just to see if there's anything else that we can find. Is that okay? So I'll just be putting my hands on your chest and a few bits and pieces. So first I'll be looking your face. It looks quite not a bad colour, a little bit pink in the cheeks. Are you able to just pull your eyelids down for me? I'm just looking for any discoloration, for anemia. Just down a little bit further, I can't see it. Here we go. And are you able to open your mouth for me? Lift up your tongue, down. So checking for any cyanosis, central cyanosis, and any other abnormalities there. Now we're looking at the neck. I'm just going to have a feel of your neck. Okay, I'm just going to check your trachea. So just checking for any tracheal deviation. And that feels all pretty in line of where it should be. Then I'm just going to get you to turn your head to the left side, and I'm checking for any jugular vein distension, which looks pretty wonderful there. Can't see anything, so good news, happy days. All right, and I'm just going to put my hands on your chest, and I just want you to take some nice deep breaths in and out. So I'm just feeling for bilateral chest expansion to make sure it's equal, as well as any subcutaneous emphysema, if there's anything else I can notice, but it seems to be pretty equal and good. Okay, and when I was touching there, did me touching your chest create any pain?
No.
Not at all. Okay, cool. All right, now I will check your hands. Do you mind just putting your hands straight out for me? Okay, I'm just going to have a little look first, looking for any splinter hemorrhaging, any tarring, any abnormalities, any kind of ganglions or maybe bits and pieces. Now, are you able to pop your nails on your fingers together? So I'm checking for any clubbing, which there's slight clubbing there. Okay, and then we'll come back out, nice and still, checking for any tremors. And if you could pop your hands up as well and looking for any flapping. Okay, all looks pretty good. Okay, awesome. And I'll just check, make sure your radials are equal, which they are. Okay, good. Just coming down, looking, you can relax now, thank you, Ed. Just checking out particularly lower legs for any peripheral edema, pitting edema, poor circulation or peripheral vascular disease, things like those. But it all looks pretty good. Have you had any problems walking or anything like that? No. Okay, cool. All right, and I'm just going to get you to sit on the edge one more time. I'm just going to do a little bit more listening to your chest.
Sure.
So this will be a little bit funny, but I assure you there is a method to the madness. So I'll just perform percussion and fremitus on Ed. Oh, I don't need this right now. Okay, so just listening for any the resonance, whether it's dull or high, indicating consolidation or pneumothorax. It all sounds pretty normal.
Excellent.
Okay, we'll do that on the front in a sec, and then I'm just going to, if you could just say the words 99.
99.
Every time I move it. Yep.
99.
Yeah.
99.
Yep.
99.
Yep.
99.
Yep.
99. 99.
Mhm.
99.
And then I would perform the same test on the front of the chest just to ensure that that is also well. So good. Okay, thank you, Ed. You can pop your hands and feet back up. So that's all not too bad.
Okay.
It's not too bad. So we're just going to do a bit more with your questioning, with your history. So can you tell me about your family medical history? Are both of your parents still with us?
Yeah, my mum is. My dad, he only died a few years ago.
Yeah, what happened to him?
Not too sure, just old age. I think he was, he was 90 something.
Oh, bless.
Yeah.
Oh, that's pretty good innings, isn't it? Yeah,
It
not
is.
too bad, not too bad.
Had a good life.
And your mum, is she well?
Yeah, she's well. Yeah, very well.
Good. Okay, and brothers and sisters?
Yeah, I do. I've got 3 older brothers.
Yep.
Yeah, they're all actually very well. They chose not to smoke. Fortunately,
Yep. Yeah, well.
Yeah.
You win some, you lose some, right? That's okay. Okay, cool. And is in your family, is there any, so no one else smokes?
No, none of my siblings smokes. I think my dad smoked for a bit, but well, he did all right with it.
Yeah, well, that was the thing they did, wasn't it, back then? Anyone have any history of asthma?
There was a bit of asthma in the family. I think my brothers might have had it when they were young.
Yeah.
But yeah, no, other than that, they don't really. I don't think they take any medications.
Okay.
I'm aware of.
And do you know if anyone's got any heart problems? If anyone's had any stenting or suffers angina or blood pressure?
My second oldest brother, they said he had something like AF or something.
Okay. Yeah. Okay.
He was about 40, but
Yeah. Okay.
yeah.
Okay. Beg my pardon. Okay, so maybe a bit of AF in one of your brothers, but they all sound like they're not doing too badly. Okay. Now, Ed, what, are you retired or are you still working?
No, retired.
You're retired.
Yeah,
What did you do for a crust?
I was a builder.
You're a builder?
Yeah, whole life.
What did you build?
Houses.
Houses. So that would have, did you have much to do with like stonework, masonry?
Not so much, no. Just lots of houses, really.
Yeah, I guess that's still
timber, timber frame.
Yeah, would have put you around a fair bit of dust and things like that. Which could have, had a
didn't
bit
have
of
masks back then.
Yeah. Okay. So, Yeah, it's a pretty hard job for a long time. So, do you do any recreational drugs?
No, God, no.
What
Just the
minutes are
legal ones.
Okay.
Just the legal
Just the legal ones.
Yeah.
Okay. And any alcohol?
Yeah, I do. I'll probably go through about a case a week.
Okay.
Yeah.
Okay. And you don't look like you're in bad shape. You're not really overweight. Do you do much physical exercise?
Oh, I still get out for a surf. Yeah.
Oh, good on you. That's
Yeah.
good. And how's your diet?
Yeah, pretty good. Pretty good. I don't eat fast food. I do a lot of cooking myself.
Cool. And no, do you have any autoimmune problems in your family? You would know if you did, or do you specifically? Have you ever heard of that? No.
Never
Okay,
been
good.
told that. No.
And are you prone to infections? Like, do you suffer?
I do get a couple of chest infections.
You do?
I do.
Yeah. Okay. All right.
Yeah.
And at the moment in your life, do you ever suffer with anxiety or stress, or are you having a particularly stressful time in your life at the moment? You don't think that could be affecting your breathing at all?
No, I'm retired.
Oh, happy
Having the
days.
best time. Yeah.
And what's happening this week? Are you living alone?
Yeah, I live here by myself.
Yeah. And have you found that your current illness is affecting your daily, like your cooking, your showering?
Yeah, I find it a
just
bit
your
harder
daily
to
living?
get up and get around.
Yeah, that's a bit of a
Breathing
problem.
gets a bit bad.
Yeah. Look, I think today's definitely a transport up to our hospital for you, Ed. You know, you've ticked quite a few risk factors. Although it looks like you've got a bit of shortness of breath, it looks like you've got the early onset of maybe an infection. There is a couple of things we'd like to test for, especially you're in that age category, risk factors of, could be cardiovascular, could be heart. I don't think it is, but we do need to confirm. I'm going to do a test. It's called an ISTAT, and it can help identify if there is any infective markers or if there is anything in your blood that can point out any cardiac markers that point to. But we'll take you up to hospital, we'll get a few things done, hopefully get you on some antibiotics and just get a few other tests done just to get you back here safe and sound to keep surfing for another day.
Sounds good.
Awesome, let's go.
Excellent.